Today we have with us two very esteemed gentlemen who have served the Department of Health Services in various capacities with maternal and child health. First, I'd like to introduce Dr. Sundin Applegate. Dr. Applegate has been in the Peace Corps in Nigeria. He served as the Associate Chief of the Bureau of Maternal and Child Health here at the Department of Health Services in the late 70s, 1976 to 1980. He served as the Chief of the Office of Children's Rehabilitative Services here in the department from 1980 to 1992. And from 1992 to the present time, he served as a medical director within the Division of Public Health Services. Also with us today is Dr. Michael Clement. Dr. Clement has been the director of Cochise County Health Department in the late 70s, 1970-81 to 1981. He served as the assistant director of the Division of Family Health Services with the Arizona Department of Health Services, and was the chief executive officer of what was known then as the Arizona Crippled Children's Hospital from 1981 to 1985. So we'll be interested in hearing more about that. Dr. Clement has worked with the Department of Health Services in various capacities as a consultant since 1991. Also is a lecturer at the University of Arizona and serves as faculty at Arizona State University. Dr. Clement has served as the Children's Rehabilitative Services Medical Director from 2005 to the present time. Tell us more about when you first started working at the Department of Health Services. Both of you started around the same time in the late 70s, early 80s. What do you recall as being some of those top issues that that you felt the need to address from a public health perspective in maternal and child health?
Well, for me, when I came into the department, it was perinatal care, plus as part of that, prenatal care. Mm-hmm. And I don't know, as a fairly late comer to public health, I remember being surprised when I got into practice and discovered that there were women who actually didn't have any prenatal care and delivered.
Ted Baum, who was then chief of maternal and child health, came up to Berkeley to interview students who were looking for positions. And he said, I can't remember exactly how he explained it, but the position was medical director for EPSDT, early and periodic screening, diagnosis, and treatment of the Medicaid program. And for those of you who've been around for a while, you may remember, probably not, that we had a fully functioning fully staffed Medicaid program in 1976, 75, 76. And in fact, I have a copy of the EPSDT manual that we produced. But the only thing we didn't have was any money.
Can you tell us a little more about any relatively unknown facts about or stories you have about things that happened when you worked here in
Oh yeah.
Well,
maternal
one
and
of
child
them
health?
is our attitude towards Indians. In 1935,
Showing his age, Native Americans.
no, they're Indians.
Oh, okay.
If you read the documents from the 30s and 40s and 50s and 60s,
They're Indians.
they're Indians, and
Yeah.
they're an independent nation, and they get all their help from the federal government. They don't pay taxes to Arizona, so we're not going to serve them. And so for many years, the crippled children's program as it was in the Department of Public Welfare. And I have the minutes from the board, the Commission, the Public Health Commission from the 30s and 40s. And the big debate was what to do with Indians, the Indian problem. They refer to it in the documentation. In spite of all of that viewpoint, we were very aggressive about establishing traveling clinics on the reservation.
But looking back over the past few decades, what would you see are the major accomplishments in maternal and child health in Arizona?
Well, clearly newborn neonatal care. I mean, Arizona is a pioneer in regionalization and recognizing that not every hospital can be a research center, that they do the best they can. And the establishment of guidelines for perinatal care, I think, is a long-lasting one.
Yes.
The genesis was a Robert Woods Johnson grant to Project Apache, a perinatal approach to community education, health education. Was if you work that out, it spells out Apache.
Ah. We loved acronyms back then, too.
I would agree with Sundin. I think the perinatal things that have happened in Arizona have been outstanding, and we have been a model for the nation. Our infant mortality rate in 1960 was like 52.
Our last data is from 2009, and we've had the lowest, historically, the lowest infant mortality rate that Arizona's ever had. In 2009, it was down to 5.9.
We now have 90% plus of our babies born in centers that are appropriate for their birth weight. And when the preemie program, AP, whatever it was called in the late 60s, early 70s started, it was 30%. So they put a big emphasis on neonatal transport, of course. They started 4 centers in NICUs. Then the APP, Robert Wood Johnson, came in, and we did all of the regionalization and all of that business. And maternal transport didn't start until about 1974.
I think what strikes me too is it's really a reflection of the commitment of the provider community to contribute to that system and ensure the health of those moms and those infants.
I mean, it's been a partnership and a collaborative approach.
What about any other major accomplishments or major changes in maternal and child health? And Dr. Applegate, you've worked with the newborn screening program for a number of years. You helped launch the child fatality review program. You have any thoughts about those 2 programs in particular? Well,
nobody remembers the fact that for half of its life, the newborn screening in Arizona was accomplished by the Colorado Department of Health in their laboratory.
Oh, yeah.
And they did virtually everything, including the follow-up. Using the specialist physicians who were caring for the babies clinically, we would notify them that Colorado notified them. I like to say that the total staffing for the program was 1. And that was me. It was all handled by contractors by Colorado, and they did a wonderful job. But then they said we can't provide follow-up services anymore without getting some money for it. We want to charge you, the health department. And we said, it's not in our budget. Because they were paying for the rest of their follow-up with a fee that they charge for the test. I said, why don't you just charge Arizona babies? Or their guardians. I can't see the baby writing a check. And they said, no, we're not allowed to do that by our Constitution or whatever. And so that's when we began screening in our own state laboratory and developed our own follow-up staff. And
Do you remember about what year that was?
95.
Oh.
1995.
Right.
Child fatality, there'd been a committee meeting for several months before that, debating what to do about the issue of child maltreatment and homicide, in essence, for battered babies who died. And that was the emergence of the forebear of the child fatality review.
It started, as I recall, in the early 90s. Is that correct? Or predated that?
A little fuzzy.
Yeah, sometime
But
around
it is
there.
a great model, and we've been able to review 100% of the deaths for a number of years now. And I think it is really a reflection of the volunteers that we have in place across the state and that commitment to find those preventable factors. Well, here's our last question. Give you a chance to offer any other thoughts or messages you want to share with folks who are watching this video, like years from now, 25 years from now.
They did what?
Man, that's medieval.
I would hope that the legacy left behind by the efforts that we've all contributed to it will be recognized and will still be intact.
Yeah, I would totally agree, and in particular, the perinatal things that we've done, the regionalization and all of that. That has been so positive and has such a great effect on the health of mothers and infants that that is what I would like.
Great, and happy 75th to Title V. And as we move into the future, and in this year 2010, which was also passed landmark legislation with healthcare reform, we'll be really interested to see what happens in the future. So thank you all.